Welcome to the orientation for the University of Iowa College of Nursing, Masters of Science in Nursing, Clinical Nurse Leader Capstone Clinical Immersion course. I want to take just a minute to tell you a little bit about what the CNL Capstone Experience for the summer of 2010 is all about. The objectives for this short module are to give you a brief discussion of the CNL role, basically describe the components of the role and the expectations that the CNL student will achieve in the capstone experience, talk a little bit about the preceptor's roles, and then describe the project and how you can help the student be successful, as well as how this can be a contributor to your unit. So, a thumbnail sketch of what the CNL role is about. The clinical nurse leader is a response to the Institute of Medicine reports and the aims for improvement in healthcare improvement. The 6 IOM aims are that as a system, healthcare needs to be safer, more effective, more efficient, less filled with delays, more focused on what the patient wants and believes to be of value, and reducing of disparities between elements of our population, or more equitable to all recipients of care. So the CNL role was created, and the CNL is designed to be a local generalist. So they could be in any setting at the unit level. They are designed to be a change agent, so that they would be focusing about 50% of their time on clinical practice and about 50% of their time on specific targeted improvements that are of value to that given unit. So the students in this program, in addition to learning to be a nurse, are learning to be systems change agents, individuals who are focused on quality improvement and elevation of standards of practice. When the CNL was conceived about 9 years ago, it was a grand experiment, and there were 5 models of education that led to a CNL credit degree. The University of Iowa is a Model C program, and that is a model where the students can have a baccalaureate degree in any other field. Could be art, music, history, biology, business, and they really do come from those diverse backgrounds. The diversity in their background and life experience is designed to help them look at the healthcare system with fresh eyes and bring their skills and experience from their other fields to help healthcare kind of think about things that might be of value that are known in other fields. They are learning to be nurses, as well as learning to be systems analysts, improvement designers, and change agents in 20 months. So they are novice clinicians, and their clinical proficiency is very similar to a senior baccalaureate student. In addition, they do have the academic preparation for the skills development in healthcare improvement and elevation of standards of practice. So what will the students come to you having already learned? They've had all of their didactic or classroom nursing courses like med-surg nursing, maternity, public health, and so on. They'll also have had 3 clinical courses where they've had 585 clinical hours directly in a setting of care. They've had 14 simulated experiences, including one with medical students and one with hospital administration students, and they've had 4 graduate nursing leadership courses. So what are they embarking on this summer? The summer actually starts the 12th of April, so the Capstone Experience goes from April 12 through July 30th. The focus is for the student to master, polish their clinical expertise in one setting of care. They'll do that under the direct supervision of a staff nurse preceptor. They'll be doing 365 hours total across those 14 weeks. That's subdivided. They will have 300 hours of that 365 where they actually have an assignment of a patient. So they'll average between 24 and 36 hours a week. The other 65 hours are really intended to get them a broader view of how the system works. So they should be planning to attend team meetings, looking at how the organization addresses quality, safety, products, infection control, and similar kinds of initiatives. The AACN, American Association of Colleges of Nursing, has identified some program competencies, and you will have that in paper in front of you. So the competencies are centered in the following areas: nursing leadership, where they would learn to be advocates for patients, for peers, and for the profession of nursing more broadly. They would learn to be masters of the care environment, so that they would be identifying opportunities for minimizing risk and improving systems of care. As clinical outcomes manager, they might be looking at outcomes related to patient education or staff education. Change agency, where they were looking at effectiveness or efficiency of given elements of care delivery and the implementation of evidence-based practice. So the logistics of how the course goes: they do have class on Monday. They are in class from 11 in the morning until 3:30 in the afternoon. Other than the class period, students are available to work the preceptor schedule. Schedules could be any day of the week other than Monday. Could be days, evenings, nights, weekends. Nights bear another minute of discussion. If the student is trying to get to leadership preceptors or get to organizational meetings, it's difficult if they work a straight night schedule. So if that's the best preceptor on a unit, we can work with it, but we would certainly ask agencies to think hard about whether or not a night shift person will allow the student to be able to get the organizational exposure to understand the system more broadly. It is ideal if the student has one preceptor during this experience. So if the preceptor knows that they're going to be gone for 3 weeks of vacation, or they have a planned surgery, or they're going to deliver a baby, that may not be the best individual to match up with the student. We can work with 2 preceptors if that's really necessary, as long as the 2 preceptors really communicate well and connect with the student so that the student's progression is clearly being monitored. Any more than 2 preceptors, and it begins to be a pretty disjointed experience. So what are we looking for from the bedside preceptor? We really want somebody who will mentor and nurture this student, help them identify and reach their learning goals. It's really ideal if this is somebody who can be quizzing the student and saying, why would you do that? Or when you did that, what were you thinking? Are you confident that was the highest priority? Or should something else have been done first? And kind of scanning the environment and looking for any other opportunities where the student could be engaged in something that would help forward their learning. We do give you the end of program competencies and a checklist of some of the experiences that the AACN has identified would be helpful to forward the student's development. And we are looking for the preceptor to give the student and the faculty evaluative feedback. So the clinical experience, very similar again to a senior intern. We're looking to enhance their clinical reasoning, look at priority setting and delegation. Many of the students, very similar to the national data on new nurses as they enter the profession, many of these students have a tendency to do the thing that presents to them first, rather than having strong logic for why you might group certain tasks or why one thing would need to be done right away and something else would be able to wait. And they tend to want to do everything themselves, and so need help and guidance in making decisions about delegation. Communications are a large focus of the class, and students have been working over the last 2 semesters on making smooth handoffs, both within nursing, between shifts and between settings, and handoffs of information across the interdisciplinary team. And the students absolutely are thrilled for any opportunity that they can have to continue to polish bedside skills, such as putting in an IV, giving an injection, working with nasogastric tubes, etc. The faculty will visit 5 times during this experience, and the student will be expected to present a patient. Again, we have given you the presentation format, and we are asking the student to give report in a brief datas format. In datas, the D is the patient's demographics, their diagnosis, their date of admission, date of critical procedures like surgery, and their diet. The first A is the student's assessment of the patient. The T is tests that the patient has undergone and values or results of those tests. The second A is alerts, such as isolation or DNR. And the final thing is S, and that is, what is the patient's status? How are they progressing compared to the expected course of a patient of that type? What are the plans for discharge? What are the kinds of resources that might be needed to make that transition smooth? So it's ideal if the preceptors can really help the student think. So if the preceptor can themselves think out loud and explain their rationale, as well as really question the student, so that if the student is developing the information for their presentation, help them by questioning to say, so what were your assessment findings? And if you notice a gap, help them fill in what other information would be important to know for a patient of that type. So daily guidance, then the preceptor will be expected mid-semester and at the end of the semester to do a formal evaluation of the student's clinical performance. Then each student will also have a secondary preceptor, and that person will help them to really shepherd their project. So they will look at the end of program competencies, help the student identify a project that would have utility for the unit where the student is assigned, as well as meet one of those IOM aims: safety, timeliness, patient-centeredness, and so forth. The faculty will be assessing student clinical proficiency based on their own observations, based on the input from the preceptor and the seminar presentations that the students do, and they will be trying to help the students stay organized, develop their project, and really think deeply about how they could make improvements in any healthcare setting. The faculty will assign the course grade. So just a moment about the Capstone Project. The student will do this project, which focuses on one or more of those aims. So for example, if the student is looking at bloodstream infections, that might address the Institute of Medicine aim of safety, and it might address the Institute of Medicine aim of efficiency. And the student would speak to why they chose bloodstream infections, what the data would be that suggests that that's an opportunity for improvement on the unit where they're assigned, and then they would work through all of the tools that we are going to be learning in class. So they might do a root cause analysis or a failure modes analysis, a process map, use statistical process control, and design what would an opportunity look like if it was addressed in more than one way. They will then work with the people on the unit that they are assigned to identify which of those approaches would best fit in that environment. That's the end of reality. And then the student shifts to hypothetical and writes about what would their change process look like, who would need to be involved, what would the timeline look like, what would they measure, how would they look at hardwiring so that that change was sustained rather than being flavor of the month, and how would they evaluate whether or not it was meeting the need that they set out to address. So the preceptor is really essential to help them gain data for their project and connections within the organization. Again, we're looking for the student to spend 60 or 65 hours within the organization, attending meetings, connecting with individuals who would be helpful as they work on the project. That is not 60 hours sitting at a computer and writing. That is really actively engaging with others in the organization who do the kind of work that the student is trying to learn how to do. The students have all been given sample projects from other CNL programs and from the individuals who graduated last year, but they're really intending, and our intent is that they would connect with the organization and help you work on something of interest in your setting. The projects are due the 21st of July. The student will have a project outline that is turned in on the 24th of May, where they will have identified what is the project that they're going to undertake, and it will be signed off by leaders in that unit. And then there will be a mid-course checkpoint, again requiring a signature from the organization, where the student will say, here's how I'm doing on this project, this is how I've identified what the opportunity is, this is the data I'm using, and this is the approach I'm taking. And again, that will be signed by somebody in the organization, and that's due in mid-June. Then at the end, the student will present their project both in the unit where they did their experience and at the College of Nursing. In the unit, that can be in whatever form is most useful to that microsystem. So that could be a presentation at a staff meeting, it could be a poster, it could be a patient education brochure, a video, whatever meets your needs. Then the students will present a poster in the College of Nursing. The posters will go up on July 27th, and on July 28th from 2 to 5 p.m. the students will be present next to their poster and their abstract and available to discuss their project and answer any questions. Preceptors and anybody else from the agency, as well as students from other programs, faculty, friends, family of the students, all of those individuals would be very welcome to attend, and of course we'll have a little food. And then the students do graduate on the 30th of July. So the summer of 2010 is the second time that this course has been taught. We are really interested in your ideas and feedback. We have made some substantial changes in this experience for 2010 over what we did in 2009, and we want to practice what we preach and stay fully engaged in the idea of continuous improvement, and so are very seriously, very sincerely interested in your ideas and feedback. The preceptor roles are absolutely essential for this experience, and we are so very grateful for your contributions to the education of our students. We want this to be a fun and mutually rewarding experience, and would love to have any sort of identified issues brought to our attention immediately rather than waiting until we come for a visit, or heaven forbid, until the very end of the semester. So contact information. I am the course professor. I am Ellen Cram, and I'm also the assistant dean responsible for this program. There are 4 clinical faculty who will be managing the student visits, and they are Kurt Long, Shalom Tonelli, Victoria Steelman, and Gina Andrew. We thank you so much for your time and attention. Your investment in the development of future colleagues is absolutely heartfelt, appreciated, and essentially important. Thank you.